These are my note cards. If I were to ask you your thoughts on video games, what's the first thing that pops in your head? That they're fun and entertaining, or that they're violent and cause school shootings? Even though some video games push the limit on violence and sexual themes, they're not the monsters the media portrays them to be. Media tells its audience that it causes psychopathic killers and makes kids fat and lazy, even though the vast majority of people benefit from video games. Studies have proven that video games can be beneficial to the society. Medical professionals use them for treatments, educators use them for programs, career professionals use them for stress relief, and families use them for exercising and bonding. My name is Matt Mercurio, and for the next few minutes I will tell you about the benefits of video games. Even the most violent video games have some constructive role. In the medical profession, video games are being used more and more for treatment. One group of people that video games benefit is people with Parkinson's disease. More than 500,000 people in the United States alone have Parkinson's disease. In a study by the Academic Journal of Applied Technologies and Innovations, people who suffer from Parkinson's disease were given the game called Nintendo Wii Fit to play 2 times per week for 8 weeks. The results were basic mobility increased 34%, balance increased 35%, walk-in performance and overall health increased 42%. In a study in Tel Aviv, they studied stroke victims. One group were given normal rehabilitation exercise while the other group played video games. Both groups had improved in grip, but the video game group were twice as many arm movements, and the movements were goal-directed, not repetitive exercises. According to the author of the study, video games were fun and made the patients commit more to rehab. Video games are also beneficial in childhood cancer patients. The video game Remission has the patients shoot cancer cells, overcome infections, and manage symptoms of nausea. In the American Psychologist Journal, a study at 34 medical centers worldwide had 2 groups. One group played Remission, and the other group played other video games. The results were the Remission group had greater adherence to treatment plans, they managed their care better, and knew more about cancer. This study was so successful that more than 200,000 patients played Remission. Surgeons also benefit from playing video games. In the American Journal of Surgery, games that simulate laparoscopic surgery have improved the skills of the surgeons. In a separate study, surgeons that play at least 3 hours of video game a week had 37% fewer mistakes than surgeons who did not play any video games. Video game also has cognitive benefits. In this study, advanced gamers played against novice gamers in a first-person shooter game. The advanced players saw faster and more accurate decision-making, increased creativity and imagination, improved hand-eye coordination, improved focus and concentration. And by the American Psychologist Journal, the games Call of Duty and Halo had the same effect as college courses aimed at enhancing the same skills. A study in New Zealand in 2012 studied the effects on individuals who suffer from depression. In the study, 168 teens who were treated for depression were studied. One group had one-on-one counseling, while the other group played Sparks, which is a fantasy video game. The people who played Sparks had 44% of them were cured from depression, while the other group, 26, were cured. Families also bond and exercise because of video games. The console Nintendo Wii, with its basic motion-based controls, is fun for both parents and kids, and is also very good exercise. Even though video games have some negative effects, most players can see the positive effects clearly. As I have shown you today, I hope you see that video games have more positive effects on our society.